Well, this is a good question. It's one that Jessica and I began having a discussion about a year ago, right? About a year ago, when NAIOMT came to us and asked us to think about putting together a specialty course, and maybe particularly one in pregnancy. And we both thought, how important is it for manual therapists to be able to not feel intimidated treating a pregnant client? I think they're worried about, maybe they don't understand the physiology as well. They're worried about, should I tell them to exercise or should I not tell them to exercise? Can I mobilize them? What kind of exercises? What changes?
Right. And I would add that I'm really moved to do it just by virtue of the numbers, like the sheer numbers of women who, we have nearly 4 million births in this country every year, and nearly 80% of U.S. women will carry at least one baby to term, like at least one pregnancy to term. And so it represents this amazing opportunity for us to just continue to engage. And so I feel like I'm really, really motivated by that, and that if we continue to just pass it off as, oh, well, that's the women's health thing, we can count on the women's health therapists to do that, we're going to always be chasing our tail. There aren't enough of us to do that, and there never will be. I mean, when we look at numbers like that, so I think that that's one big reason is that those of us that would count ourselves as the women's health therapists, we need help. Like this, we can't do it all. We don't want to do it all.
They need help.
Right. There are just too many people that need help. That this is not a territorial thing. We need as many people involved in this team and helping to provide better maternal health care.
Right, and it's not all, and the interesting thing is 80% of people who are pregnant will have some sort of back or pelvic girdle pain experience, but it's not just about that. There's a lot of pregnant clients that are running, doing triathlons, that are dancing in ballet companies up until their 8th month. They have other kinds of things going on, cervical spine problems. Carpal tunnel is another big one. Feet and ankle issues, and a big one is balance issues.
Right.
I think most people don't realize that in the 3rd trimester, that's one of the highest risk groups for falls.
Yeah, so, and then on the flip side, we've got really increasing numbers of people entering pregnancy who are struggling with obesity and being overweight, and that puts them at increased risk of gestational diabetes and just a whole host of complications that are really well addressed by physical activity, but they're scared. They're not well equipped. And again, I feel like that's a huge place, so that we're talking about people that are really high functioning and wanting to continue to do that in a way that respects their changing body, and then folks who maybe just don't have a great relationship even and don't know where to begin, and but are looking at this as a season of life where they can start adopting some better habits.
And many of them are so motivated because they want to have a healthy pregnancy and they want to do the right thing. And I think PTs want the guidelines and the resources to be able to confidently be able to counsel somebody like that on exercise and changing and moving into some of those healthier, sustainable habits.
Right.